Well, welcome to Health, Wellness, and Lifestyle on Wednesday with Linda Dorman and Dr. Donna Christensen. We are here on the OurTV.network broadcast, and we're very excited to be broadcasting from the Virgin Islands. Dr. Christensen, are you in the Virgin Islands today?
I certainly am.
All
I'll
righty.
be here for a while. I'm not doing any traveling anytime soon.
And I'm in the great state of Maryland on the what we call the mainland. So today we generally have a guest with us, and today we wanted to just actually wrap up kind of the first quarter conversations around different health topics, kind of do a roundtable, trying to get some more information in to share with our viewers and our audience, as well as talk about some things that are new, and of course give some preempt to actually those who are coming up, and just have an open conversation about women's health. But first, I just want to make sure that we just do a real big round of applause. We just do a round of applause for Dr. Donna Christensen. This is almost the end of Women's History Month. And we would be remiss not to, again, just lift you up, Dr. Christensen, because you made history being the first physician, right? And the first female to represent the beautiful islands of the United States Virgin Islands in the House of Representatives. And so that has to be noted, because all of our firsts allow for a second, third, fourth, fifth, and so forth.
Exactly.
We just honor you in that, and we were so glad to have you with us as always. So why don't we just talk about, some of the things that we've been talking about on the show. But before we do, remember we had, thought we would touch on kind of a very touchy subject, and that's the Women's Health Protection Act of 2022, because this is a very touchy subject around women's reproductive rights. And what does that mean in terms of federal legislating the protection of these rights for access to abortion care? So that's what the Women's Health Protection Act, WHPA, espouses. And I know that some of your former colleagues, probably still in the Senate, have given great debate over the last couple of years. And of course, we know that on earlier this year, the U.S. Senate voted on the Women's Health Protection Act in its first ever Senate vote on proactive legislation to enshrine or to make permanent the rights to abortion as a federal law. Let's just stop right there and just ask.
I didn't really realize we were going to talk about that. So you go ahead, because I need to update on where we are.
Yes, but I mean, there's just a thought process on this question, and I know that you can give that because you've been around the halls of Congress and the halls of Senate. That why would we still have to actually talk about women's health protection rights at the federal level? And these can go with any rights of women as it relates to reproductive health. Why do you think we haven't arrived at a place of what some would say is common sense, that women should be in a position to dictate their own health and not have legislation to have to push that?
It's politics, nothing but politics. We still have, I remember so many times having to fight for the Violence Against Women Act to be reauthorized. I mean, it was always a battle. We demonstrations, rallies to get the last votes in, especially in the Senate, for that. So women have always had, for some reason, to fight harder. I can remember when the military decided to approve Viagra as a medication, and we women had to go over there and tell them on birth control pills, and they were not doing birth control pills. So we had to go over there and do a little acting up to get them to include birth control as well in their formulary. We shouldn't have to fight for those things. Now, abortion is a political, it's a social issue, but it's a political issue. And in my experience, a lot of times politics has trumped science.
Yes.
In my experience at the House, and this is one area where it has. This is just one. There's others. Needle exchange was another So there's where we are. So the fact that it passed is really,
Well, it passed the House,
yes, it passed the House. That's what
and
I got.
you gave us a
And
very good civic lesson around the difference between passing the House of Representatives and then moving into the United States Senate for a vote, and how
yes,
the
it's
conference
not going
that
anywhere.
works in terms of being able to get the bill all the way through. And so while it was, passed, it did fall short of 60 votes to overcome the filibuster. So, it's very challenging that we are still, as you said, politics seems to trump common sense health, and there are lots of reasons for and lots of reasons against. The religious sect, obviously, those who espouse to the fact that life begins at conception, are maybe different in a thought process from those who believe that women should have the right to decide the fate of their own bodies. So I think those are two different
Exactly.
schools of thoughts. And
And there's no woman who relishes the thought of having to have an abortion. It's it's like a last resort when nothing else is going to be a workable arrangement. And um, I've had to counsel young and older women around abortions, and it's a difficult decision. It's not a decision that women take lightly.
no, there's no decision that you would take lightly, to particularly abortion. But there are so many valid reasons why some women would need to opt into that decision: for health, for preservation of the mother's health and life. Um,
Yes,
in acts of violence against women that produce a situation where there is
a
a
pregnancy.
decision for abortion, because now you are making a decision to either continue on with the pregnancy that was born out of the violent rape, sexual assault, or not, or continue forward. I mean, there's just a whole host of reasons. There could be extreme reasons that include the health of the child, if that is a part of the decision making based on the privacy and rights between a family, a wife, a husband, a mother to be, or a woman, or even a child, with their healthcare provider and those who would be a part of supporting that decision. I mean,
Yes,
this is where we have to think that it is our rights to make those decisions and to do so. And at the federal level, at that Senate and U.S. House of Representatives,
they
Congress.
shouldn't have a say. Government should not have a say in this decision, and most certainly we should not have bounty hunters out looking to make money off of individuals who, for whatever one of those very good reasons that you began enumerating, decided to have an abortion.
Mhm.
I
Yes.
like what the governor in California did. He did the same thing. He introduced. I don't know if it passed the California legislature, but to do the same thing around guns.
Hmm.
To have people report and be able to sue if somebody had an assault weapon or something like that. That's not going to fly either. But,
Well,
but it's a tit for tat kind of thing. But it points out the ridiculousness of Texas law that others are seemingly about to follow.
I mean, I think it's based on a lot of different things. Who's ever in at that moment, sitting in that seat of representation, we bounce back and forth as we have election after election, generation after generation that comes forward, and we get laws passed that make good sense. They get repealed or they get reformed to the point where they're no longer truly effective for the people that for which you were sent to, elected, duly elected, and sent into those seats to represent the views and the ideas that makes sense for everyone. So, the WHPA, the Women's Health Protective Act, Health Protection Act, would protect abortions. This is very specific, and we know it's controversial, and sometimes we just have to have that controversial conversation.
Mhm.
Would protect access nationwide, so in those Bible belts and in those more liberal states and in those progressive in betweens, that's nationwide, and in the territories, including the Virgin Islands, of course. by creating a statutory right for healthcare providers to not only to provide and have a corresponding right for their patients to receive abortion
Yes,
care, free from restrictions and free from bans. So that means that not only is it going to support the providers, so we know that we see a lot of providers who, gynecologists and those who would otherwise perform abortions in that reproductive care uh, vertical and healthcare. Those individuals need protection as well. So
they
it's
do. They've been attacked. They
they've been
have been
attacked,
attacked.
they've been murdered, they have been picketed against, they have really been boycotted. And it's not really fair because it is about providing viable health care. Long since are the days, Roe versus Wade, where back street, back corner, alley abortions that can kill and maim and really devastate a family should be long gone history.
Yeah.
Yeah.
We should not go back to those dark days again.
Exactly, exactly. So,
So we'll see. The Supreme Court still has um, the cases before them. I'm not very hopeful about what they're going to do. So it's going to take legislation that's also difficult. Um, I know this is not a political show, but it just points up the need, whether you vote for Republican, Independent, or Democrat, to not be strictly partisan, to vote for people who are support your values. Support your values.
and
More than it's over 70% of people in the United States believe that abortion should be legal. So
well, I agree. I mean, as you stated earlier, it's a hard decision that I'm sure a woman would have to make. I
it
feel
is.
blessed, and I think thank God that I've never had to make that decision. But I think had I had to make that decision, that I would do it with the knowledge that I had the right to access healthcare. That if I made the decision, that somewhere out there in my community, with my providers, my medical providers, my doctors, maybe even mental health counselors, family counselors, my family minister, that somewhere somehow that the decision would be supported in a way that says my health has to come first. Now, there's lots of times we think, is this just a convenience? And I think that might be part of the argument,
Mhm.
that you found yourself in a position that you didn't want to be in, and the convenience of having an abortion allows for you to continue on with your life, versus thinking and recognizing what we believe, or as some believe, or others believe, is the conception and the beginning of life. That's a controversial statement in itself, because there are some who believe life begins outside of the womb in such a way that you can sustain yourself. And then some believe that you should have a right to life or right to living. So those
Mhm.
children who are here, who are not receiving social services that should otherwise be afforded, what do we do about that? Maybe we should put some of our energy and our resources into
Well,
creating quality of life for those amazing children who are here, who are
exactly.
part of
And we can do a lot more in making the kind of services available to women and to men. It looks like they might have a men's birth control pill coming out soon, to prevent the need for a person to have to seek an abortion. And as you said, let's also care about the children who are born and are alive and who also need our more of our care than they're getting today.
Well, let me give you a little something that just kind of takes me aback from the Center for Reproductive Rights. This is, if you want to look it up, everyone, we're not here to give you an opinion one way or the other. We're just here to give you some information on things that should make you go, and give you some thoughts around your own personal health care as part of your health, wellness, and lifestyle. So the Center for Reproductive Rights reports that politicians have passed nearly 500 state restricting abortion, restricting access to abortion over the last decade. I mean, that's 500 laws restricting abortion access over the last 10 years. That's
Yeah, sure.
remarkable. And
Mhm.
these restrictions have eliminated access to abortion care in large part in the United States, right here. And they report, this is the Center for Reproductive Rights that reports that 90% of US counties are without a single abortion provider, and 5 states are down to their last clinic. We can't verify that information. We're not looking at the United States map and counting it up, but we're going to take them at their word at this point.
Mhm.
The people hurt most by abortion restrictions are those who already face social economic barriers. And we know exactly who that is. We've talked a lot about social determinants on our program,
Mhm.
accessing healthcare. That's the problem. Those are the same individuals who are having an issue. And that includes those in the Black community, the Indigenous community, basically people of color. And there's a terminology, BIPOC. I actually particularly like that because it's pretty broad. And then obviously women, those who make men's, the social economic strata. So those who are on under poverty, underserved, at
Mhm.
poverty, struggling.
Yeah.
Um, and then we add in kind of this other category that we hadn't traditionally thought, and that is the LGBTQ plus community. Obviously there's another subset: immigrants, young people, those living in rural communities that already have problems accessing any type of health care, let alone abortion care. And then this is something that I had never really thought about, and that is people with disabilities who do engage in intercourse, that come and have a full, vibrant life in that regard, and come to the place where they're pregnant, or they're in a position where they have been assaulted and become pregnant, or they're impaired for whatever the disability creates an impairment, where they're not able to make viable decisions for themselves, but become, in fact, impregnated. Those are the individuals, all that I named, that face barriers to just accessing healthcare in general, let alone the daunting task of accessing abortion care. Isn't that staggering to think about that? I mean, that
Yeah.
is just.
Yeah. And while we were talking, the disability community came to mind because I've
Mhm.
had some experience with that for in the past as well. But yeah, we always need to consider those people that have anybody that has special needs. And really, if you just put it in the category of special needs, all of those categories
Mhm.
have them. So
Yeah, I think it's interesting because 60 this is 60. um when I think about the fact that this bill did not pass the Senate based on 60 individuals, and the hundreds of thousands of individuals that are going to rely on these 60 to have participated, I think about the voices of the senators who were in favor. And again, the Center for Reproductive Rights is really kind of summarize some of those comments. And I think it'd be important to share with our listeners what some of the senators who did support said. And that's: Congress must codify into law what most Americans believe, that abortion is a fundamental right, and that women's decision over women's health care belong to whom? Women. That's the Senate Majority Leader Chuck Schumer.
well, it wasn't blatant in the questioning of Ketanji um, Brown Jackson, but it was there
Mm-hmm.
in the issue around uh, what's the word? Precedent. What's precedent? And
Yes.
then there's another legal term for things that are accepted as law. They may not have been in the Constitution, but they've been accepted as law, and I don't remember that term.
Well, it's
And
not
so questions were asked about that, and
Mhm.
she answered yes. She, you know, uh, supports considering precedent and this other category as well. So did the two more recent appointees,
Mhm.
but they have not. I can trust what Judge Jackson said. I can trust what she said, but some of them, just to try to get through, sort of suggested that precedent was important and circus. I'm going to find the word in a
Well,
minute.
after when we go in the commercial break, we can, because we'll wrap up this part of the conversation around abortion and Women's Health Protection Act. Because I think about my daughters. What's their future going to look like? And part of why this Women's Health Protection Act, in my personal opinion, is so important is that it does set a precedence for legislating and making laws that are either restrictive or not restrictive,
Mm-hmm.
for women accessing all kind of health requirements. When is it going to stop? Are we going to stop at how do we legislate breast health, or is it going to become a challenge for a woman to receive a hysterectomy if she wants a hysterectomy for particular reasons, or even not? Just where does it stop at this point in time? We just don't know. And it's very, very daunting and very challenging that healthcare has become anything but personal. Senator Patty Murray from Washington State, and of course, these are Democrats, and we don't have, like you said, a political show, but we can't be divorced from the fact that there is a parting of the seas, the Red Sea, on this
Oh
particular.
my goodness, for real.
We have to acknowledge that. And I'm okay with it, because sometimes healthcare is just like that. But the vast majority of Americans, Senator Murray says, wants a country where the very personal individual decision about pregnancy is up to whom? The individual. That is
Exactly.
exactly what the Women's Health Protection Act would do. And that is from Senator Patty Murray. And it speaks to the fact that in the privacy of my home, again, with the opportunity to have good counsel and make sure that I am in the right frame of mind, and that it's a responsible decision that's being made, and it's not a forced decision being made by someone else. These are the kind of personal individual decisions around women's health that women should be in a position to make. So if you're a woman who does not support Abortion Act, then you have that right to make that decision as much as a woman who does. And I think for me, overall, we want to make sure that women have access to the kind of health care that is important for their general health. But when I think about my daughters going forward as adult women, I don't want them to have restrictions when they're seeking health care in an environment already challenged with health disparities among African American women, and even
So,
African American women.
I mean, when you think of a country that can't even pass an amendment to grant women equal payment and equal rights, it's a matter for concern. The term is called stare decisis, and
Stare
it means
decisive.
to
Okay.
stand by things that are already decided. They asked those questions, I know, because of the question of abortion.
Mhm.
Um, because it is a precedent, it's a right that's already decided. And when they asked some of the other now jurists, they responded affirmatively to supporting that principle, but they have not.
Yeah, I mean it's
We'll
it's
see.
daunting. It's daunting. I mean, for those who would be against, and we'll pay some kind of balance to that. I know that there's a great deal of conversations around what does gestation look like, and when are abortions to occur. And it's a very, very interesting website. If you go to the numbersofabortions.com, I mean, the website is a very uh, very interesting universe to explore, and there's all kind of things, but it is something called the numberofabortions.com. Unvalidated information, but it gives a clue as to those who keep track of these things, that there's been purported in the United States just in this year alone, so the first 3 months, over 200,000 abortions performed. How and where, and when we have communities that are underserved, it makes you wonder. And then
Okay.
allegedly, in the US, after gestation, which is 16 weeks that we talk about, 13 to 16 weeks, a little over almost 11,000 abortions have occurred. And it's very, those numbers, if they're to the degree that we understand them, really do make you pause and ask yourself, what are we doing about educating our young, educating those who are not victims of violence that created a pregnancy state. But those young people, how do we get our hands wrapped around women's health care for even young women to really
Yeah,
think through contraception?
I think we need to take a break. We can take that up when we come back. But yeah,
Oh,
it's an
yes,
uphill
yes.
battle for women for in many aspects of our lives.
Okay. Well, let's take that break real fast. We're in the health, wellness, and lifestyle program with Dr. Donna Christensen and Linda Dorman. Woo! Thank you. welcome back to the Wednesday Wellness Program, Health, Wellness, and Lifestyle with Linda Dorman and Dr. Donna Christensen. We have been talking about a very taboo subject that we're going to now leap onto something else, the Women's Protection Act of 2022, and hope that it will continue to move forward or find new life, no pun intended, for 2023. So, Dr. Donna Christensen.
And it depends on getting out to vote and making sure that your vote counts in November of this year.
Wow, that was a mouthful right there. So let's not let that, getting out the vote. Yes, because healthcare matters in this country when we vote, and we vote in numbers. So yes, get out the vote this coming November 2022 in your hometown.
That's what will make the difference. Yeah, I think we had some very interesting programs in the first quarter, and I particularly liked Dr. Underwood, the program with Dr. Underwood on cardiology. We talked last week about a women's health issue and breast cancer. We've done. I think that was really important. I hope that the survey is going well. Yes. And we also had a good program on kidney disease, which is something that's not often talked about. So,
and we've had sickle cell. We did a recap.
Sickle cell, yes.
And because we were in women's health, our guest who talked about the breast cancer awareness actually is someone who suffered a stroke. So we had some conversation
that's true.
Back in February about that, and March about that. And then we've never let go of this subject, and it's a big one, particularly given some of what we saw just in this week. And I feel like I don't even want to talk about what we've all saw was the slap that went around the world. Because there's been so much discussion about it from so many commentators.
Well, maybe we ought to have a program about alopecia.
Talked about.
Yeah, because I mean, it's not something that is commonly talked about or known. And we have a Congresswoman Congresswoman Presley, and now Jada, and I'm sure there are other women who are concerned about losing their hair, what to do about it, and whether they have alopecia or is it just something else. And I think that would be a good subject for us to take up.
Well, it's interesting because we've been fairly comprehensive. We've actually talked about autoimmune disease.
We did.
Diseases. When I think about all that we've talked about just in this first quarter, we pack really a lot in. I'm pretty sure we got all that in this from January until now. And what strikes me is two things as it relates to that is that it's autoimmune disease, and this particular manifestation of that autoimmune disease is alopecia. And we know that alopecia can take several different types of losses in terms of the immune system attacking the hair follicles. So that's how you get the alopecia. It can be a full alopecia. That means everywhere there's ever been presence of hair on your body, from what you see on your face to what you don't see on the rest of your body. All of that can be lost, or it can be partial. We really don't know, except for what we see on Jada Pinkett Smith, that she clearly has lost her hair. So we know that can be quite devastating, particularly for someone who is in the public eye. And we don't know the other associated health concerns or issues that she's also suffering from.
Right. And we also don't know if there's some background between Will Smith and one of my favorite comedians, Chris Rock, that because the reaction was just so strong and so out of character for Will that it seemed, and to me, might have not been I thought he had said something else. I was listening. I was halfway watching the program, so I hadn't heard what he had said. I thought he had said something more.
Well, there's been so many reports and so many commentaries about this, from the fact that someone emailed me this morning and said, this is a sad day for Black America. And I thought that's just taking it a little bit too far. What's really sad is how our wonderful, amazing first African-American female judge of note and in honor is being decimated in front of an amazing, elected group of individuals with the most ridiculous of questions and expectations.
Can you imagine?
That's what we should be appalled about and having more commentary about than anything.
It was hard. It was hard to watch. I watched, including the last day when other people spoke up for
Mhm.
her, and maybe one person kind of was not too keen
Mhm.
on her. But yeah, it was hard to watch. It was hard to take, and um, had to. I was home alone, so I could
It was
curse at the TV, and nobody would hear me.
it was very, very, very difficult to watch. And part of it is because it feels like what we have felt like in all other categories of what we've talked about on our program, and that is the disparity of being treated differently in different circumstances. We've talked, obviously, because our program focuses on health, wellness, and lifestyle, that we've talked about that level of institutional trauma that comes from the disparity, generational trauma that comes through the generations, historic trauma from slavery and Jim Crow, and all the things that we continue to, the brutality that Black America and people of color in America, not just African Americans, but people of color
Sure.
suffer from in this country, that it boils down to this mental health conundrum. What do we do about
Which
it? And our African American men making not one excuse for the behavior, somewhere that became a trigger. We don't know what that trigger is. We're not living in or walking in or in the mindset or heart or essence of Will Smith. But it does beg the question around: have we done enough conversations? Have we talked enough about mental health among Black men? We kind of assume that if we get women right, then we get the men right, we get the children right. But have we zeroed in on that subject? And I think that's a subject that we're going to need to
and
explore
it is.
in depth.
I'm glad you bring it up, because one of the entities that I'd like to bring on going forward is the All Healers Mental Health Alliance,
Mhm.
that I participate in the meetings with, even though I'm not a Black psychiatrist, psychologist, or social worker, which is what that alliance is made up of. And they came together around Katrina, and a lot of their focus ends up being around dealing with our communities and the sometimes lack of response that's required to make our communities whole after disaster. But it goes further, because they really are just concerned about the mental health of communities of color, and they come together to plan programs and look at what the needs are, and comment on policy as well, and legislation, to make sure that the needs of our communities are addressed. So that's the All Healers Mental Health Alliance. That's chaired by Dr. Anel Prim, a Black psychiatrist and a member of the Black Psychiatrists of America,
Mhm.
but a wealth of Black psychologists, Black social workers, Black counselors are
Mhm.
a part of this alliance. They've been in the Virgin Islands after disasters, and
Mm.
even after when our refinery closed. I remember they came because a lot of people were out of work, and you knew that there would be mental health issues around dealing with the fact that a job that you counted on is just gone, and the upheavals in your family. So All Healers Mental Health Alliance is one. And then the other
Mhm.
gets us back to cancer, which is the AC3,
Mhm.
that we're hoping we can get Dr. Robin Roberts from the Bahamas to speak on. That was who was recommended to come and speak to us on, which is the African Caribbean Cancer Consortium, that
Mm.
was founded in 2006 to further study the viral, genetic, environmental, and lifestyle risk factors for cancer in populations of African descent.
Mm.
And yeah, so it's a broad-based resource for educators, for training, for research on etiology, for screening, prevention, treatment, and
Mhm.
survivorship related to cancer in populations of African descent. But this particular group is centered in the Caribbean, and I think it would be very informative to our public to deal with it.
I think so. I would wholeheartedly agree, and I'm so looking forward to them coming on the program, because we know that by and large the population there is predominantly people of color in the islands, in the U.S. Virgin
Mhm.
Islands we're talking about, and because of that, we're able to glean and learn something that we may not be able to understand as well on the mainland US, and that is how to effectively treat communities of color, because you have such a dense population of individuals who would be a great example to us, to the providers. Everything from how do we communicate cancers, and how do we communicate health disparities? How do we communicate healthy lifestyles that lower the risk of these diseases and put that into play in a real way that is culturally sensitive and doable, achievable? Because that's
True.
what we hear, is that it's just not achievable. It's just not culturally sensitive. I like my greens. I like to kill it. Well, all those things.
And eat your greens in a healthy way.
He's from Orangeburg, South Carolina. So everything we ate was dead, dead.
Uh-huh.
We threw out
Yeah, I'm not
nutrients with
even
the water
talking.
and ate the vegetables probably with the least amount of nutrients, but they taste great and they were part of the tradition. Okay, well, that tradition has not necessarily served us well from a health perspective. So now we have to create new traditions around clean eating, holistic eating, and just
And
healthy eating altogether. And so,
one of the people that we reached out to, Dr. Ashing, I think her name is, regarding this, is also beginning a project around nutrition. So when that gets started, perhaps we can bring her on. But the researchers that are involved in the AC3 African Caribbean Cancer Consortium
mhm.
are researchers at different institutions, not only in the Caribbean, but in the United States as well. It's not just Caribbean, but
Well,
it
no.
was brought to my attention because to see if the Virgin Islands would be interested in participating in it. And I think they're funded by NIH. NIH is another issue. I'm trying to get my health profession organizations to get active in this. NIH is going to be without a leader
Wow, the National Institute of
because
Health.
National
Now,
Institute.
everyone should know the name NIH right about now with Dr. Fauci and all of the
Yeah,
all the
and
groups that we've heard with
Dr.
COVID.
Collins has been very active as well. Dr. Collins is retiring, and so
Mm,
uh, it's an opportunity for us to make sure that, or at least to weigh in on the choice to ensure that the needs of our minority communities, of any community that's experiencing disparities in health,
mhm,
are well considered in the research space. The National Institute for Minority and
mhm,
Disparity Research, which we were able to get in the ACA,
mhm,
um, has been one of the least funded institutes at NIH.
mm.
And
That's
so we
interesting.
have some work to do there too.
I wonder why. I mean, I wonder if it's just the appropriations. Is there just not an advocacy? Are we not fighting strong enough for those kinds of appropriations to be more equally spread to those parts of the institute? Because these do matter.
I know, and it,
It's hard. It's a hard
let me
question.
tell you, it was a struggle to get it from an office to
Mhm,
a center. And I wish we had just gone to institute, because then it was a struggle to get it to be an institute so
mhm,
that it would have much more authority and be better funded. And the funding did go up,
mhm,
but I, I think to some extent it's because a lot of the other institutes have really taken a part of their disparity work. I
mhm,
mean, disparity work goes on at the National Cancer Institute, at Fauci's Institute, and at others, the National Diabetes and Kidney Research Institute. I'm
mhm.
sure I'm butchering the name of it, but so they've assumed some of that role. But I think that any institute there that is doing research needs to have some oversight at at the National Institute for Minority and Health Disparity Research, and that
And that's really important for people to understand what all these organizations do that are funded with your tax dollars. And
Mhm.
because they are funded with your tax dollars, that means that you need to come into what we call the know and get to know these institutes so that you're clear. As Dr. Christensen pointed out, if you have areas within the National Institutes of Health underfunded, then it's time to write our congressmen it's time to write our senators and it's time to advocate, because what's coming out from those centers is the biomedical and public health research that's going to make a difference
And
to.
NIH itself has been very well funded. It's
Mhm,
just that, we want to make sure that
mhm.
the funding goes to is there's equity. Let me say there's equity in the research and equity in the funding. Yeah. Let me put it that way.
Exactly. And it's
But
located here in Maryland. So for those who
yeah,
don't really know the National Institutes of Maryland, you've only heard the name because of Dr. Fauci and COVID. Good for You is the primary agency in the United States that's responsible for biomedical and public health research. And because of that, it works very, very closely with the healthcare provider community as well as the medical academic community to develop these
and
research
the pharmaceutical community.
on the
They do a
pharmaceutical.
lot of the basic research that ends up in a product
Mhm.
that's making millions of dollars for somebody.
Well, that's the challenge, is that there's the level of criticism and the
You
level of mistrust is just based on that we, is this research very skewed to support the pharmaceutical community that's going to make lots and lots of money? Is it really focused in on true public health, and therefore it's in the best interest of the public? Or is it to glorify or make famous a couple of names who we then find out are part of the stock options and stock ownership of companies that are going to benefit? And,
yeah.
by and
Well,
large, someone told me, well, welcome to America. That's the American way. We're in a
but
capitalist.
I've worked with a lot of the pharmaceutical companies, and um, the research that they do is critical and needs the support. But you know, and I will say that many of them go out of the way to make drugs that are relatively expensive
Hmm.
affordable to those who would ordinarily not be able to afford it. Um, so, and speaking of pharmaceutical companies, I guess we have another booster coming up.
Do we really? Now, I haven't been that in the know. Or another COVID booster. Well, we knew that
Well,
it was going to
it's
come
approved. It's a fourth is approved,
down.
but
Mhm.
it's not promoted in the same way as the others at this point in time. It's approved. Uh, I think the research on how long the immunity from the third one is still
Mhm.
out. I don't think we
Yes.
know how much it goes down. I think at 4 months they said it may be around 80%, 78, 80%.
Mhm.
So I think we need to follow it a bit longer. But the issue is that it's approved for people who are immunocompromised or have some disability that could interfere with their body's ability to develop the antibodies based on the vaccines that they've had.
Mhm.
And CDC, while they okay they have not offered a strong recommendation, except in those particular cases.
Yeah.
So it's there, and we'll see what the research continues to show. Um,
And we do. I mean, it's important too, in case you wanted to know more about it, you can go to covid.gov. So this just happened on this past Wednesday. So
yeah.
this was, I mean, today. So today's the 30th. I just thought about that. I'm
Mhm.
on the 31st because I'm ready for April to happen. But this is fresh off of the press, that President Biden actually did get authorization, or he was able to.
I think he got his
For
fourth booster today.
Yes, yes. And that there's going to be a fresh round of money pumped into the pandemic funds that are available to the public. And that's, welcome news for a lot of communities that still are very much suffering from the
And
fallout.
it does not, I mean, we can't lose sight of the fact that everybody should still have had at least their three vaccines, which is not the case. The United States is behind Europe in the percentage of people. I don't know where they are now. They're probably a little over 60%, maybe close to 70%. The
Mhm,
Virgin Islands is a little over 60%.
mhm.
Um, it, we're talking about a fourth vaccine, but booster, but everyone should really have gotten at least the first two and the third booster so that we can be better protected against severe disease and death from these variants that come up because now we have BA2,
Yes, yes, we do.
and
And
BA2 is much more transmittable.
Mhm.
I don't know that the disease that might follow from it being transmitted is more serious, but it's more transmittable. And so you have
Yes,
more cases. And when you have more cases, you're going to have more hospitalizations regardless.
exactly.
And we still have a good percentage of our population across this country that are unvaccinated and therefore vulnerable.
And I think that those who are unvaccinated, it's very difficult. I know several of my close associates that are not vaccinated who have zero. I mean, they're not the first, second, or the third for sure, and they have zero intentions of ever having the vaccine because they are still subscribing to. We don't have enough data to say what's going to happen years from now, and of course, we won't have that data because we cannot project ourselves like that into the future. What we can say is that we have at least now 2 years, if I'm not mistaken, worth of data, enough through the trials and actual people
Millions and millions of people across the
around
world
the world, around the
have had the
world.
vaccine. What we do have is we have data on what happens when you get COVID and the number of people who are long haulers and developing more symptoms of different kinds, whether it's the brain fog or the pulmonary
Mhm.
symptoms are very predominant, and other symptoms that go on for long periods of time. And we don't know whether they're going to be recurrent. So we do know what the disease causes. We haven't seen but a few complications from the vaccine itself. And really,
We
J&J has sort of been pulled back because of the clotting that has occurred.
and
But
those things happen. That's what we learned from the community. So we're just going to end the program on
COVID causes clotting. COVID
yes,
causes
the
clotting. So,
the
I mean,
COVID
by
because of
itself.
how it treats it, how it responds in the body. So, we know the cases are down dramatically. We know that the Omicron variant created high record numbers of infection in January. But this is the daunting thing we're going to leave everyone with to get your vaccine, and that is that sometime in April we're going to cross over the 1 million mark of those who have passed on because of this disease. So we want to
And
keep you.
most of them look like us.
And most of those who have passed on look like me and look like Dr. Christensen,
Yeah.
those in the African American community. Well, this is it for the show. Wow, we did a whole year real fast in
Yes.
our conversations. So, everyone have a healthy wellness Wednesday. This is the Health, Wellness, and Lifestyle program with Dr. Donna Christensen and Linda Dormant, and we wish you great health. Until we meet again, this is our TV.network.